think we're in a really unique moment in time in our country. There is alignment across regulators and healthcare stakeholders and the broader society that it's no longer okay for our healthcare system to only work for some people. We need a healthcare system in this country that works for everyone, regardless of what they look like, what they talk like, where they come from, what language they speak, whether they're urban or rural. We need a healthcare system that works for everyone. And that alignment across all of the stakeholders, especially the regulators, creates this moment where we can actually do something. We can get beyond words about health equity and actually take steps to address it. I'm excited about what we're doing at SameSky Health is because we have built a technology platform that's allowing us to be, I think, a real leader in that process of making good on this moment when it comes to health equity. We have built a technology platform that allows us to help our health plan partners, and we primarily work with health plans today, help them to achieve their health equity goals. And those goals start with understanding who their members are at a deeper cultural level, building trust with those members. And we do that by collecting information that we've never collected as a nation before, and most health plans haven't, on their members: race, ethnicity, language, sexual orientation, gender identity, the social determinants of health, whether people have food in the refrigerator. This is what we need to know about members at the individual level in order to engage them in a way that treats them like who they are matters, because that's necessary to build trust. And when we build that trust, we can navigate them into healthcare at the right time and the right place. So that's what we're doing at SameSky Health. We've built a technology platform that allows us to deliver that kind of experience at scale to health plan members, and we're getting great results. And I'm really excited because I think this moment, if we lean into it, this moment in time, if we lean into it, we can sort of create a health equity virtuous cycle. And that's what I would like to see happen over the next 5 years. And what that cycle, it begins with what we're doing, collecting data. We cannot provide the kind of experience we want for people if we don't know their race or their ethnicity, for example. So we need to collect the data. Then we need to stratify the data based on all these demographics, as well as urban, rural. We need to understand where the disparities are. And here's what's important. We need to quantify those disparities, because if we don't quantify them, we're never going to know if we're addressing them. So once we collect the data and we stratify it and we quantify the disparities, then we can attack those disparities with new programs and resources. And that's where regulators come in. And then we'll measure to see if we're reducing those disparities. That's a virtuous cycle of health equity. That's what I think we are on the cusp of in our country. It's an exciting moment. And I'm just so pleased that SameSky Health is a part of making that happen.